final webinar in our series dedicated to research, literacy, and evidence-informed practice. My name is Deb Hill, and I am with the Academic Consortium for Complementary and Alternative Healthcare. This series, we're the host organization for the series, but it's also been produced in conjunction with the Alliance for Massage Therapy Education, the Commission on Massage Therapy Accreditation, the Massage Therapy Foundation, as well as the National Certification Board for Therapeutic Massage and Bodywork. So thank you everyone for joining us. A couple housekeeping matters up front. All attendees are on listen-only mode to control our background noise. This session is being recorded and will be posted at a future date on our website. And if you have any questions, please go ahead and type those into the question box on your control panel, and we'll get to as many as possible at the end of the presentation today. So welcome everyone. For those of you joining us maybe for the first time, I wanted to describe a bit about ACAC, the Academic Consortium for Complementary and Alternative Healthcare. We're a broad multidisciplinary organization that fosters interprofessional collaborative care, and we consist largely of 5 core professions. Each of these professions has a programmatic accreditation body that is recognized by the Department of Education, and massage therapy is one of our professions. Through our member organizations, then, we are linked to about 400,000 licensed healthcare providers and about 180 accredited institutions and programs. And we really work to advance the values, practice, and disciplines associated with integrative health and medicine. So before we move along further, I wanted to go ahead and introduce our speakers for today. First of all, we have Molly Banamine. Welcome, Molly. Molly is Centerpoint. She's the education director for Centerpoint Massage and Shiatsu Therapy School and Clinic, and she's received her master's degree in educational psychology from the University of Minnesota. She has worked as an academic advisor at General College and at the U of M, college programs coordinator at the University of California, Santa Cruz, retention coordinator, and most recently as the associate dean of student development and services at St. Paul College. In addition to her administrative experience, Molly has been an instructor in student leadership at UCSC and college success strategies at St. Paul College. So welcome, Molly.
Thank you.
Next we have Geralyn Cambron, and she is a professor in the Department of Research at National University of Health Sciences and adjunct faculty in the Epidemiology and Biostatistics Division of the School of Public Health at the University of Illinois in Chicago. She's taught numerous research-related courses and postgraduate seminars, including Introduction to Research and Biostatistics, Epidemiology, Public Health, Critical Appraisal of the Literature, and Writing Case Reports. She's also served as a principal investigator on research studies focused on both massage therapy and chiropractic care for over 20 years, and currently serves as the president for the Massage Therapy Foundation. So welcome, Geralyn.
Hi, Deb. Great to be here.
And next we have Renee, who is the Assistant Professor and Clinical Education Coordinator for the School of Massage Therapy at Northwestern Health Sciences University. Michelle has been a massage therapist and craniosacral therapist since 1998. She received her Doctor of Chiropractic in 2008 and is currently working towards her master's degree in acupuncture. She also enjoys a small private practice in Southwest Minneapolis. So welcome, Michelle.
Thank you. It's a pleasure to be here.
We're happy to have you all with us today. And before we get started, I just wanted to review a brief agenda. We do have a big agenda for today. We're going to start with reviewing why each of these institutions have chosen to include evidence-informed practice and research. Michelle's going to go ahead and discuss evidence-informed practice in the massage therapy program at Northwestern. Geralyn's going to discuss a broader EIP initiative at National University of Health Sciences. And Molly's going to discuss a unique capstone project at Centerpoint that helps students tie evidence-informed practice into the clinic. So I hope that you'll all stick with us till the conclusion of our webinar, where we'll offer some tips to incorporate EIP from each of our speakers. So first up, we have, this question, I'm going to ask this of each of our presenters, is what brought you basically to include evidence-informed practice and research into your program? What was the reason that you chose to do this? So Molly, we're going to go ahead and start with you. Just a couple of sentences on the reason behind this.
The reason behind our choice to integrate it into our curriculum is that while students are in school, we're really teaching them to think critically about what they're learning, and that the tools that they're learning are going to be applied to people. And that requires them to ask questions because everyone is different. And while they're in school, they have the ability to talk to their classmates, they're interacting with instructors regularly, and oftentimes once they finish and go out into practice, they're often practicing independently. And so teaching them how to use evidence-informed practice and research will allow for them to reach out into the broader body of knowledge and to continue to ask the questions and so that they can continue to evolve as practitioners.
Great. Well, thank you, Molly. Michelle, what was some of the reasons that, I'm sorry, Geralyn, we're going to move on to you next. Geralyn, what were some of the reasons that National had gone ahead and put that into your curricula there?
At National, we really believe in continuing education and long-term learning, that once people leave our educational process here, that they're not completely done learning, that they really need to continue moving ahead with what does the current literature have to say. And so we just think that it's important to make sure that our grads are aware of how can they stay up on the most recent literature and kind of trends in healthcare and medicine.
Great. Thank you for sharing that, Geralyn. And Michelle, what were some of the reasons that Northwestern had incorporated evidence-informed practice into your curricula there?
Well, I want to echo some of the things that have already been mentioned, and then in addition to those, we feel strongly that we're educating massage therapists as healthcare practitioners, and as such, we really wanted to make sure that they were prepared to have the understanding of research literature and evidence-informed practice in order to have those dialogues with other healthcare providers, and in addition to be able to educate their clients more fully about what they're doing and why in order to create those most optimal treatment plans. So those are some of the reasons that we decided to include it.
Great. Well, thank you all for your excellent summaries, for bringing out the importance of including research and evidence-informed practice into your programs. I wanted to go ahead and move along, and Michelle, I'm going to turn the floor over to you as you describe evidence-informed practice in your massage therapy program. So I'll turn it over.
All right, thank you so much. Well, right now we are including our Foundations of Evidence-Informed Practice in our first trimester. So it's one of the first courses that the students take. It's something that we have changed over time. So this is a recent change for us that we're moving it to the beginning of the curriculum, and that was a student-driven change. They really requested that they felt this would be valuable for them to learn early on so that they could continue to apply that material as they go through the rest of their program. We give them several opportunities to apply the information later in courses, of course in their clinic environments when they're seeing a diverse range of clients with different presentations, and it gives them an opportunity to identify the need for more information and use the strategies to search for that information. And then we have a class called Massage Therapy for Special Populations where they have an opportunity to actually write a case report on a complex case. So they select a client that they want to work on. They have a minimum of 4 visits with that client to treat them. And before they start on the case, but after they have selected their person, they do a complete literature search and find as much information as they can about the concerns that that person is presenting with, and use that information then along, of course, with their patient presentation and the clinical experience to create a treatment plan for that person for those few sessions that they're doing. And then in the end, they write all of that up into a case report and present that to the class. So that's a fantastic experience, not just for the process of doing the case report, doing the literature search, selecting the correct outcome measures to illustrate their results, but also that presentation process to the class gives everybody else an opportunity to hear about all of these unique cases, all of these different client presentations that many of them haven't had a chance to see yet, and to hear how that experience went for the students. So that's sort of a summary of currently how we have it fitting into our curriculum. Then we have, for our course objectives, what we've selected for course objectives are the 5 things that you can see on the slide here. So defining evidence-informed practice and talking about the importance in healthcare delivery. So for that piece, I feel like we really spend a lot of time talking about how this skill set prepares them for being in healthcare. prepares them for being able to communicate more effectively with other healthcare practitioners, how it makes them more effective communicating with their clients, how different clients make decisions different ways, and so being able to access that information is really key, and being able to be fully educated about what's in your treatment room and how you're going to be able to address that safely for the client. Talking about the fundamental principles of research is huge, because that allows us to identify what do different types of research tell us about different conditions, and what don't they tell us. It allows them, in terms of critical thinking, as Molly mentioned earlier, you know, we hear on the radio every day these sound bites about there's new research out about that you should eat eggs or you shouldn't eat eggs, and how do you go look at that research and assess that for yourself and decide what it's actually able to tell you. So learning how to speak that language of research is really important. Doing that critical appraisal, of course, is the continuation of those basic principles. And then talking about the importance of research in our discipline. So as they start to do literature searches, and as we have projects for them to look at information on particular topics, one of the things that we immediately come away with is the real lack of information that there is in terms of some of the things that we're interested in. One of the key pieces about that is I think it inspires some of these blooming massage therapists to think about careers in which they could contribute to the research body, that this isn't something that just happens in a laboratory, that when we're talking about clinical research, we're talking about practitioners like us that are contributing, that are designing research, that are finding some funding for that research. So that's a really key piece. And then effectively applying that research evidence in practice. Again, you know, giving them some clinical opportunities to do that, but also having enough times that they just get to try it out and do quick searches. I find it to be really helpful to just give them 5 minutes to search on something, have a discussion about it, talk about what each person found, compare and contrast those things, is going to make them far more likely to apply these strategies when they get out into practice and don't have one another and their faculty to talk to about cases. This practical application is really key. So in terms of what we include, this is a little overlap with what we just looked at in terms of the objectives, but we spend a lot of time talking about those concepts of research. Again, learning that language of research is so important, because when we first start the class, many of them have never looked at research literature before. They aren't familiar with this. It all looks like it's written in Latin. They don't know how to decode what's in front of them. So as we start to learn the terminology, as we start to learn what defines different types of research, what kinds of questions are answered, then all of a sudden the world opens up to them that they can understand those big concepts and begin to learn about how do you ask a question. So when we first start the class, it doesn't occur to them necessarily how many times they could ask a more in-depth question that could give them really important information. And of course, very often, clients are going to walk into our clinical settings with conditions that we either barely remember being mentioned in our pathology classes because they're rare conditions, or things that we've never heard of before. So really important to have the skills to do an efficient search to figure those things out. So we talk a lot about how to do efficient searches, how to start right off the bat with reliable sites, using the internet thoroughly, and then also accessing the librarians that are at their disposal, both as current students and as alumni. We have some phenomenal library resources at our particular school at Northwestern. But in the future, also on their own, they're going to know how to go to some efficient and reliable sites and get that work done pretty quickly. And then we talk a lot about outcome measurement tools. This is one of my favorite topics that we cover, because I feel like this enters into their clinical approach on a daily basis. Yes, it's really important for understanding research literature and knowing if you're able to get the answer you're looking for from the literature that you're looking at, but it's also something that we utilize every time we see a client. So rather than feeling like we should apply the visual analog scale or the 0 through 10 pain scale for every client that walks in the door, there are in fact many other really useful outcome measurement tools. So this, again, opens up a whole new world for students about how they could measure their progress and how they could explain that progress to a third-party payer or to talk to their client about whether they're actually reaching the goals that they set for themselves. The thing that we decided not to include in our Foundations of Evidence-Informed Practice is the statistical analysis piece. We feel like massage therapists often don't have math as one of their strong suits going into this kind of an industry. So that scares a lot of people, and it makes it hard for them to settle in and really embrace some of the bigger concepts that we think are important. So we take the math part out of it and instead help them see the big picture, help them understand why it's important as critical thinking, and then absorb some of those other important concepts instead of getting hung up on the math and the statistical analysis. So timing-wise, I think I mentioned we recently moved the course to the beginning. What we initially did was we taught it at the end. We felt like we wanted to have students have a bigger understanding about their clinical skills. We wanted them to already be in clinic. We wanted them to already understand different types of massage therapy, different kinds of interventions, to have already have some knowledge about pathology and things like that. So at first, that's what made sense to us. But what we found was putting it at the end of the curriculum didn't give them an opportunity to apply those skills very well before they graduated from the program. And actually, it was then the student feedback at the end of the course. I'm happy to say that our feedback from students has been extraordinarily positive about how much they enjoy the class and how important they find the material. In fact, they found it to be so useful and important that they requested that we move the class to the start of the curriculum so that they could have more chance to practice it and work with their faculty and their classmates and their clinic experiences to utilize those skills and really make it a part of what they do in massage therapy. So that was a fascinating process for us, and it also feels like now we're in our first couple trimesters of teaching this to the first trimester students, and they're very open at that stage of the game. They're not fatigued yet from being in school for a year or several months, and they're very open and excited to learn this aspect of being a healthcare practitioner that for many of them never occurred to them before coming to massage school. So it opens up their minds in a new and different way, I think, to put it at the beginning of the curriculum. I think that's been a good change for us. So we do a lot of class activities. We teach the class during one trimester, so that's about 15 weeks. It's 1 hour per week, and what we do is include some classroom activities every day of the course. And during the course itself, we spend half of the class periods in a computer lab so that every student has a computer in front of them, and they get to do searches in real time together, and we talk about what they find, and we discuss the strengths and weaknesses and the different articles that they find. Discuss different search strategies, and really spend a day delving into how do you ask the right questions, how do you ask the right background questions, and then what does a search look like to find information about that. How do you do a good foreground question search, and how do you find the information there? What are the most efficient ways to do that? And then again, with the outcome measurement tools, we do that in the computer lab where they can have access to that. And that's something that really could be and is applied in a number of different environments too. So they have computer access in their clinical environments, so they could sit down and do a 5 or 10 minute search on a particular client that they have in their clinic environment on that particular day, or they could do the search after the client is gone to gather information for the next time they see the person. And then, of course, the special populations project that I talked about earlier is another way that we do those classroom activities. We'll also just give them different types of research when we're in the classroom itself and not in the computer lab. I'll give them different types of research to read through and then pick out the important parts of that. So identifying what basic science research looks like compared to what clinical science research looks like. Identifying the differences between quantitative and qualitative research so that they understand the importance of both of those things and also the different ways that they show up in the research, just again to learn how to speak that language. And then how fantastic it is when we can find a really good piece of summary research that's done a lot of work for us, and as massage therapists we don't want to spend 6 hours gathering every article on the topic that we're interested in. If somebody else has already done a really thorough piece of summary research, that is gold for us. So we spend time looking for those, reading through them, and just getting comfortable with that language and how to utilize that information and apply it in our treatments.
Great. Well, thanks, Michelle, for sharing all the points about your program and more about your program. I know that you talked a bit about timing in terms of some of the lessons that you've learned, but if there's anything that you could change, knowing that you've been doing this for a while, or that you have changed over time, is there anything that you would change, I should say?
Well, yeah, I mean, the other thing that we have changed over time is taking out that statistical analysis piece. That was something we included initially when we began teaching this, and it made the content so dry and so daunting for some of the students that they really didn't leave the course seeing the practical application of the material. So what it's transitioned into over time is a far greater emphasis on the practical application, both as a massage therapist but also just in the real world. It's very valuable for us as educated adults to know how to sift through information and find what is meaningful to us. So I like for them to leave the course with that strong sense of how important it is just in life, as well as how important it is as a practitioner. And for us, that meant taking out a lot of the numbers, getting bogged down in the numbers, because I feel like for us as massage therapists, that's really not the most important piece of it. So in a nutshell, making it feel practically applicable and important for every single topic was a key piece for us that we learned over time.
Great. Well, thanks for sharing that. Hopefully others can learn from what you've already learned. We don't have to reinvent the wheel here. I do want to just take a moment and let our audience know that if you do have any questions, please go ahead and type those in, and we'll get to as many as possible towards the end of the webinar here. So next I wanted to move on to Geralyn, and she's going to go ahead and talk about the evidence-informed practice across a bigger setting in the National University of Health Sciences. So, Geralyn, I'll let you start out.
That was not my intro music.
That was a nice introduction.
No, I'm just kidding. A lot of what I have to say echoes what Michelle had to say, so let me just jump in here. We have 4 different main programs, academic programs at National, and the first one is the Chiropractic Program. And this is the one where our evidence-based practice or evidence-informed practice program is most refined, and that's because we've started this quite a while ago. Even I have on the slide here that we were awarded an NIH R25 grant starting in 2005. And that grant it's an education grant in order to increase the amount of evidence-based practice within a professional program, specifically on complementary therapies. And even before that, we had some evidence-based practice incorporated into our chiropractic program. But at this point, we currently have 4 different formal courses where the EIP is included. And the first one is public health in 2nd semester, critical appraisal of the literature in 4th, advanced EBP, which is now in 7th, and journal club, which is in 8th try out of 10 trimesters. But what I want to say about this is it has considerably changed over the years. We started out with the first class being in the 5th semester. We then moved it down to the 4th. Now we've incorporated it into a 2nd semester class that's already there, the public health class, so half of the public health class is more evidence-informed practice. We moved the critical appraisal from 6th down to 4th. We've talked about moving it farther down. It's interesting as we go along this process to see that our needs kind of shift. When we first incorporated this in, I guess we were thinking of evidence-based practice as being kind of a standalone entity, whereas now we've almost fully incorporated it into like all of the classes. We have lots of teachers now that have assignments where students have to look up articles in the literature, and even in basic sciences. Like we have an anatomy teacher that in first trimester has his students pulling articles, looking at different structures, whether it be muscles or organs, and just for them to know that there is still research going on different parts of the body in terms of anatomy, and that our knowledge base is always expanding. And so that is why our curriculum, the chiropractic curriculum, has shifted over time, trying to make sure that if the students are being asked to look things up in the first and second semester, that we're able to come in and teach them, okay, here's how you search the literature, here's how you find an article, here's how you critically appraise. And so really what we have now may not be what we continue to have in the future, because it's, we kind of roll with what happens within our curriculum. So it's been kind of an interesting process to see it shift over time. We also have a naturopathic program. Deb, if you could click. And that we only have the 2 formal courses in, the public health and critical appraisal. The students in these 2 programs, chiropractic and naturopathic programs, meet in the same classroom. And so there is quite a bit of overlap with these 2 groups of students. So they take the class together. Now I know that their teachers are, in other classes, are also incorporating the literature into their classrooms. For example, the students in the naturopathic program, they have a grand rounds where a student has to either pick one of their patients in an upper trimester or a topic, like a condition, and talk about it based on the literature. And so really pulling articles. I remember I went to one of these presentations, and the whole back row was filled with other faculty members. Of course, the student was nervous, but the student presented several research articles that were not strong articles, and the faculty members were asking questions about it. And, it was just a really good research-grounded type discussion. So, these 2 programs have quite a bit of incorporation of the evidence into the curriculum, but not just with these different classes. And then we have an acupuncture and oriental medicine program, and in that there's one class that's just called evidence-based practice, and it is more of a standalone. It hasn't infiltrated out into the other classes quite as much. And so really the chiropractic program at our school is the one that has the most evidence-informed practice incorporated into it. But each of the programs have different needs and obviously different courses, and so we really, as a school, are trying to make sure that each curriculum fits the needs of the student as to what they're going to be going out into practice, and what do they need to know, and what's the best way for them to learn. In our massage program, we have it a little bit different. It's more like before 2005 in our chiropractic program, where we tried to just have guest lectures here and there about the process of evidence-informed practice. So in our massage program, it's a 3-semester program. In their first semester, they get just 2 hours, 2 course hours, not 2 credit hours, but 2 hours on introduction to case reports. We really think that having students read case reports, they're just more palatable to the students, for lack of a better word. They're more understandable. They're not heavy with the research lingo and statistics and all of that. They're really something that a student can read and say, oh, when I get out into practice, I could do that too. I could see a patient and treat them like that too. I might see results like that too. And so we want to introduce them to research and how to read the literature through the intro to case reports, and also get them thinking about when they see clients in 2nd and 3rd trimesters that this is something that they could do. Massage Therapy Foundation has a case report contest for students, and so we like to make sure that the students are aware that they can enter that case report contest. We also like to make sure that students are aware that there are new guidelines for writing case reports, which actually help with reading case reports. They're called the CARE guidelines, C-A-R-E. And if you go to ijtmb.org, which is an international journal, you'll see, for therapeutic massage and bodywork, I should say, you can see the CARE guidelines modified for the massage profession. And so it will go through and talk about, in a case report, we really need to have a full description of the type of massage. We need a full description of how were they assessed and when was the client assessed and what outcome measures were used. We also need a description of who was the person doing the massage. Were they a massage therapist who was trained and in practice for 30 years, or was it an RN who took this as a side course, or who actually was the one applying the massage? Just if you're a teacher out there and you're interested in case reports, I want to plug, there's another website called CaseRe3, CaseRe3.org, and CaseRe3 is a repository of case reports. And so if you're interested in having your students read case reports, this is a great location that you can go to find some that might be interesting to your students. So that's what we have in the first trimester. It's just a 2-hour lecture. The second trimester, we have a course, an EIP course, and this is fairly new. It's about a year old. We found that we really needed to have some dedicated time within the curriculum in order to teach some of the skills of evidence-informed practice. And so we were able to kind of shuffle things around, and there was a class that could move around a bit, and we were able to acquire 8 of the hours within this class. And so this class is kind of broken into 2 different sections. So the first is something else, and then the second is the EIP. So we don't even have a full semester hour of EIP, but within these 8 hours, they learn quite a bit on just searching the literature, and I'll explain this in a minute, but it's 8 full weeks, 1 hour a week of going through some of the EIP practices. In the second semester, we also have 1 hour lecture in their clinic meeting just on outcome measures. How do you know how to measure whether a person's getting better? And how do you know that that measure is quality? There's a great website out of Canada. It's called INCAM, I-N-C-A-M, and it's their health outcomes database. And they have where you can just type in, like let's say you have a client with carpal tunnel syndrome, you can type that in and try and look for what outcome measures might be the best quality outcome measures to determine, is this client getting better or not. We can always make up outcome measures and just have a drawing of a hand and ask them to, draw on this hand, where they feel any symptoms, whether it be pain or numbness or tingling, and that's great. But if there's a reliable and validated survey or questionnaire out there, that might be a good thing too. So we spend an hour in the clinic meeting talking about outcome measures. And then in the third trimester, we just spend 1 hour kind of reiterating that there is research that goes on massage therapy. We go through the research that we've done here at National. We talk about a little bit of research that's out there in the world that might be up and coming in the future. But really, what we're trying to do in the EIP course, Deb, if you could click one more time, please. We're trying to do a lot. So in this 8 hours, we talk about how to read an article. For example, what are the different sections, and what would you expect to see in an introduction versus methods versus results and conclusions. We talk about the different study designs and why is a case report kind of lower quality than a clinical trial and a meta-analysis. We talk about how to search the literature. We have them search PubMed and find some articles, and we do talk about basic statistics, unlike Michelle, but I think it's a very small portion of the class, and so it's more like what is descriptive statistics, percentages or average, things like that, versus inferential statistics where you get a p-value and why are they different and which is stronger. We also talk about how to evaluate an article, and we have the students read articles, and then how to communicate research findings. We actually, the articles that they read, we have the students, either as individuals or in groups based on the size of the class, give presentations on the articles that they've read so that the whole class can kind of share in the knowledge base, but also so that each individual student can practice talking about what did a research article actually say. And so in our massage program, we're still shuffling things around and seeing what fits and what doesn't, and working with the students to try and determine, was this helpful? Are these things that, in the future will help them in their practice? So we've talked to grads and tried to find out, what really will work best for us. And I think it's a work in progress, but this is something that, I would expect that every curriculum is a work in progress. So this is what we do for our program currently.
Great. Well, thanks, Geralyn, for sharing all that across a wide variety of programs. I know that at National you have had a really long history, as you presented, with evidence-informed practice. Thinking back, is there one lesson that you really think has come up again and again that you've learned throughout the course of instituting this across the university?
Yeah, there's two actually that
Okay.
I would say. One is what I keep trying to reiterate, and that is this is trial and error. This is like anything else that you're implementing into a curriculum. You put it in, you see where it fits, you shuffle it around, you change the content, you see what's working and what's not working. And so our students now are getting more savvy. They're coming out of high school knowing about PubMed, so that shifts what it is that we need to teach. And so it's really trial and error. The other thing that I didn't really stress, but I would like to, is you have to teach the faculty. When we first started with the chiropractic program, it was, as I said, kind of a standalone course, and it led the students to start asking other teachers, non-research or evidence-informed teachers, about new research. Do they have any new articles? Have they searched the literature? The students would bring in articles and challenge the teachers. And this was not, it was a very good time because, we don't ever want to embarrass our faculty.
Right.
And so we want to make sure that our faculty are just as aware of how to go through this whole process as our students are, so that they can do it together. It doesn't mean faculty have to be perfect at it, but at least they have to have somewhat of a knowledge base as to what is PubMed and how do you access these articles and how do you read and critically appraise articles. So that's what I would suggest.
Great. Well, thanks for sharing all of that information with us today, and hopefully, again, as I said earlier, you can those listening can learn from what you've already learned. I did note a theme that you had mentioned in terms of making, putting your case reports up front and making it more palatable and applicable and not as dry. So I do want to. That's a nice segue into our next presenter here, which is Molly from Centerpoint, and she's going to tell us about how they've really kind of jumped the gun and put this right into the clinic, and with a nice research project. So Molly, why don't you go ahead and describe what you're doing there?
Sure. So part of our clinic program is that students take a summary session class, and this class is taken in conjunction with their clinic experience. And so we had originally had research projects in our final technique courses for both our massage and our shiatsu program. And we found that it was a bit overwhelming to the students. They were really in depth and engrossed in the techniques that they were learning, and it was hard to get them to really understand the combination of using their techniques with research and asking critical questions about why it is that they would use those techniques as they were learning the techniques. And so we moved it into the summary session, which is really meant to be almost like a practicum experience for the students. So as they're going through clinic, they meet weekly to talk about their clinic experience, the clients that they have, challenges they may have faced, things that they're coming up against as they try to apply these newly found skills. And so we thought it would be a better fit in summary session to really encourage the students to learn how to access the greater body of knowledge to help guide them in their practice, because they are one-on-one with a clinic client when they're working with a client, and they do have a supervisor in clinic, but it's not the same as it is when they're working with each other in a technique course. We wanted them to be familiar with the practice of using academic resources as a tool to inform their treatment planning. We also have a special populations course, and they learn, for instance, about working with HIV and AIDS in that class. Well, it may be 5 years after they finish until they encounter their first HIV and AIDS client. And we would really want them not to fall back on the knowledge they learned 5 years ago in school, because there would be much more recent research, and we want them to know how to access that information. So they can use what they learned in school as a baseline, but to think critically about what has changed in the time since they've either interacted with a pathology or interacted with a client with a certain disease. And then to emphasize the importance of accessing current research to educate their clients. If they have clients coming in that are wanting to use massage or shiatsu as a complementary therapy to therapies they're receiving in Western medicine, we want their clients to be able to go back and talk to their doctors about what it is that they are receiving and why it is they're choosing to do it, and to then also educate the medical community on the efficacy of massage and shiatsu therapy. And so for the assignment, the students select a disease or an ailment to research. They're then asked to create a treatment plan that includes treatment goals and desired outcomes, and then the follow-up recommendations for the client. And in our massage program, they do a Western analysis of whatever disease or ailment it is that they choose. They go through and do symptoms, etiology, and then the most common medical treatments. We really want them to understand if someone is going through lymphoma, what are they likely going to be facing when their doctor says, okay, you have lymphoma, here's the course of treatment we'd like to embark on, so that they have a better understanding of how they can support the treatment as it goes along. And then to create real treatment plans, even though these are fake clients, because the likelihood of them in student clinic encountering a client that they would work with regularly is small. And so we decided to let them do fake clients rather than a real client, to allow for them to be more creative in the treatment planning. We want to know what the desired outcomes are, what their strategies are going to be, and then we really talk a lot about follow-up recommendations. So what do they want that client doing with them, and then outside of the experience of the massage or shiatsu, how often they'd like to see the client, and then what other modalities they think will help in that treatment plan. And then for our shiatsu students, we have them look at it from both a Western and an Eastern perspective. Then their treatment sequence is to design a full body sequence for one pattern or pathology of the disease, because we really ask that they go in depth and look at the underlying and root causes, and so it needs to include the meridians, key points, techniques, etc. And then they talk about their goals and outcomes and follow-up recommendations. So the students are given this assignment at the onset of the summary session and have the entire summary session to work on it. And the instructors check in with the students about every week to every other week about how it's going, to really see how they're doing, if they're doing the research, if they're taking the time, and if students aren't really understanding conceptually how much work really truly needs to go into this project. The instructors are pushing them to say, this isn't something you can do in a weekend, you need to be spending time working on this. And then the students write a 3 to 4 page paper and do a 3 to 5 minute presentation for their class. And over this last term, what we found was that the students' presentations were 10 to 15 minutes because they really got into the project and had a lot to say and a lot to share with their colleagues. And the other students in the class really loved hearing about the different perspectives and ways in which you can approach a treatment session. And as I said before, this project is a part of our summary class, and that which is taken in conjunction with our clinic and acts as a capstone for really integrating what they've learned academically to this point and their beginning experiences of working in a student clinic. All of the skills that we hope are used in this project have been addressed in many of the other classes throughout the curriculum. And just to kind of echo what my colleagues have said today is that it's ever evolving and ever moving. And so as we piloted this program this last term, I realized, some of this isn't talked about enough in other classes, that there's potential that a student will get to this summary session class and this will be the first time they interact with maybe doing the research or doing the research for a specific disease. And so this upcoming term, we've integrated a small research project into our special populations course where they work together as a group to seek out research and to evaluate the research. And then independently of each other, they will each come up with a treatment plan and then come back together and share their treatment plan so they can see how research can be interpreted differently even though they're all looking at the same research. They do lit reviews in their very first term, which is really useful, but for some of the students it's quite a while before they do this project, and so they don't always remember what they learned in that first term. And so working with my summary session instructors to have them go back to the materials from that class to review what it is that they already know about the skills necessary for doing research is something that we'll be integrating this term. And this is our first term with it, and it was a pilot, and both instructors that taught the class felt that it was really, it fit well into the summary session, and that the students really liked having that connection of being able to learn how to use the resources out there for them, so that when they had new clients coming and they found themselves using the skills they were using for this project for the new clients that they were meeting.
Great. Well, thanks, Molly, for sharing that. And I think you kind of hit the nail on the head. I think I was going to go ahead and ask you, being your first semester, what you would change and moving forward. And I think you did a great job at summarizing that. Is there anything else that you would like to really stress as a kind of a takeaway point of what you've learned over this semester?
I just want to echo what Geralyn said about educating your faculty about what they're doing. I think we've run into kind of the same thing where this is an assignment that my instructors are meant to give to the students, but I don't know how much time I spent with my instructors talking about evidence-informed practice and what their background knowledge with it was. And so even after just participating in this webinar today, I'll be having a meeting with my instructors to kind of talk about what do you know, what kind of questions are they asking you, and do you feel qualified to answer those questions? Because we assume as educators that they have that background, and then I step back and remember that my instructors are first and foremost therapists and experts in their field, and they are educators second to that. And so how do I help them be better educators?
Great. Well, thanks. Thanks for sharing that. And I'm sure others on the line today can learn as well. Since I have you kind of in the hot seat here, I've asked each of our presenters today to maybe come up with some tips or maybe some words of advice that you might have for educators looking to fit research and EIP into their program. And Molly, I'm going to go ahead and start with you. If there's one tip or one piece of advice that you'd like to offer up that you've learned as you've gone along here.
I think just to be flexible. I think we all talked about just that every curriculum is constantly evolving, and you can sit down and think, okay, this is what I want to do. Here is the idea. We're going to do this research project, and you try to implement it, and the students either aren't ready for it, you have it in the wrong class, they don't have the background skills. So just to be always asking the questions of what worked, what didn't work, and how can I do this differently, and not taking it as a failure if it doesn't go exactly as you've planned, but more of a learning opportunity.
Great, kind of always evolving, in other words. So Geralyn, did you have a tip or a piece of advice, looking back in today's webinar as well, that you'd like to offer
Sure.
to educators?
Just like Molly was saying, you have to be constantly evolving, and it's okay to start small. So even if in your curriculum you don't have room for a full class, like we don't, we have a half a class, even if you have room for a 1 hour discussion or a 2 hour lecture, or take them into the computer lab. Now let's look at PubMed. How do you even get in? How do you search around? Even starting small is more than nothing, and it will, continue to grow, because as the students use that, the faculty will get interested, or you can start it on the faculty end and teaching the faculty in small bite-sized pieces, and then it will be incorporated into the classroom. So please don't anyone feel like, well, we don't have room, so we're not going to do this. There's always room to add
Alert from calendar. Staff.
Oops. Sorry about that. Wouldn't be a webinar without something in the background.
I know. Okay.
Great. So so start small and then see where that leads you. That sounds like a great tip. And I know, Michelle, you had also some tips in terms of how to get this right into the curricula, so I'll let you take away at this.
No, well, the couple of things that I have on my slide here are really embracing technology inside the classroom. I know as an educator, I really struggle with trying to keep technology out of my students' hands while I'm talking to them.
Right.
This particular topic is a great opportunity also to embrace technology inside of the classroom and finding those teachable moments to just let everybody do a search on their computer or their tablet or their phone and just see how easy it is to find some information and discuss it together in that moment, so that you can really show them how that would look in their lives and how simple that is. And the second thing that I'll say is that this is, as we've all talked about, really vital critical thinking as a life skill. So it's great as a practitioner, and I think it's also really practically applicable in life. And then thirdly, I just want to echo the other pieces. You know, we have been really fortunate to place this as a standalone class in our curriculum, but it is almost more important to weave it into the rest of the curriculum, into other classes in small ways, and that really requires doing those little bits of teaching with the faculty to get everybody on board. Many faculty members in massage schools have been in the industry for a really long time, and we didn't learn these skills when we were in school. So it is important to bring faculty along so that they don't feel intimidated by what their students are learning, that they don't feel they have a full grasp on. So I think all of that is really important, and to just let it grow and evolve organically within the program. So it can start little, it can look a lot of different ways, and it fits into each of our curricula differently.
Great. Well, thanks for all the tips and the advice. And I'm going to go ahead, and I just want to kind of recap what we've covered today. And really, what we've done is we've reviewed, and I have each of you on because we've reviewed the evidence-informed practice in a number of different environments. Michelle spoke about how EIP was in the massage therapy program, really as a dedicated foundational course that has now moved into the first trimester, learning from that experience. And Geralyn had really described an overview of EIP in multiple programs across an entire university setting, with both, non-specific courses woven into courses as well as a dedicated coursework. And then Molly really described moving EIP into the clinical setting in an independent massage school without a dedicated coursework at this point, and rather weaving this throughout the curriculum. So our hope is that you, the listener, will have a more broad view on how evidence-informed practice can be moved into various settings, basically depending on your individual environment. So I do want to mention, if there's anything that you wanted to go back and review from today, all of our webinars are archived on our website at optimalintegration.org underneath our events tab. And we have a number of other webinars in case you had missed them. And also, we have a number of resources that we've developed through our project to enhance research literacy. And all of these resources are for educators, specifically to get you started with evidence-informed practice. So please do check those out while you're on our website. I do want to go ahead and thank all of our speakers and thank all of you who have been listening and following us for the series. I do welcome all feedback from those of you who are listening, and I really look forward to hearing from everyone on your own journey in evidence-informed practice. So with that, I wanted to go ahead and give us some time to open this up for questions. And my colleague Jennifer is on the line, and do you have a couple of questions for us? I see. If you could pipe in, that would be great.
Yeah. Yes, Deb, we've got a few from the the attendees. The first is, the computer lab example is a great idea. What do you suggest for integration of these activities for small schools that do not have access to computers for each student?
Well, we have, I find that a lot of students bring laptops or tablets to the classroom with them. So if you know that you want to do a project like that, even just a 10 or 20-minute project within your classroom setting, I think it works also really beautifully just to ask students to bring devices to that particular class. And not everybody has to have one in front of them. They can buddy up and share a device in order to do the project, because rarely do I really want them to do it all by themselves anyway. They have different levels of proficiency on the computer, so it really often works well for them to team up with another classmate or two and do the project together and discuss it together. So I actually use that strategy sometimes when we don't happen to be in the computer lab but I want to do a small project, to ask them to bring some devices to the room and do them together. And otherwise, I can just do the search on the overhead screen with them in the classroom, and we can just follow along together. But I think it is nice for them to have some opportunities to actually do the typing on the computer and navigate the internet in that way.
Great, thank you. I think that was a great segue. So we'll go ahead. Jennifer, we had a couple more questions.
Yes.
Yep.
The next is kind of a two-part question. It says, I don't always understand the statistics. I took a college introductory course just to help with that, but it was a general course. Where can I go as an instructor if I have specific questions about statistical analyses so I can translate, if you will, for the students?
I'll bring that back out to our panelists. If there's anything that you've utilized in your instruction, that'd be great.
I think that's a really valid question, because statistics isn't something that most healthcare professionals have learned a lot about. And, even though there's lots of books out there on statistics and there's websites and things, I really think that sometimes it's best to find somebody who's a resource that you can go to and ask the questions, because sometimes when you hear somebody else describing it to you, you can then take that to the classroom. And so, sure, there's lots of books that are out there that, are basic statistic texts, but finding a resource person might be your best bet in trying to figure out how do you explain it to the students. One of the things that I'll do with students as well is say, there's always going to be things within an article that you haven't come across, you don't know what this means, you're not quite sure, and sometimes you have to just, I hate to say it, but almost gloss over it. Our chiropractic and ND students learn about p-values, but they don't learn about all of the different ways that that p-value can be created. And so, it's kind of like the rest of the terminology within an article. They may not understand all of the other words, and statistics is just one more of those things where, sure, we'd all love to fully understand all of it, but is that realistic, especially when you first start? No, it's not. And so that's one of the things where it is a big hang-up for some people, and it's frustrating, but it's you have to take it step by step and learn little by little.
Thanks, Geralyn, for that advice. Sorry.
Oh, sorry.
Go ahead.
I hate webinars. I think one of a really valuable resource just that I use personally and often tell students to use is Khan Academy, especially for math concepts. I find that their videos are really digestible. So just as a place to get yourself familiar and started, the Khan Academy can be really helpful.
I agree.
Great suggestion. All right. Well, thank you both. Jennifer, do we have one more? We think we have time for maybe one more question.
Yeah, this is the second part of that. Also, if we can't address the statistics effectively, how do we discuss evaluating the quality of the sources, since that is a big part of critical appraisal?
I'll throw that back out to our speakers. Is there a suggestion that any of you would have?
Well, I'm not exactly sure what quality of the sources means. I mean, there's so many things that can be critiqued within an article. Where did the clients or subjects come from? Were they equivalent to the general public, or is there some sort of bias in who they chose to be their subjects? What type of treatment? Was it realistic to regular practice? Who was applying the therapy? There's so many things that can be critiqued. And when we read these articles, it's really kind of a balancing act as to what are the pros and cons. We're really not looking to slaughter an article. We're looking to see, is this a strong enough article for us to feel like we feel comfortable with applying it to our own clients then and utilizing it in practice. And so looking at the whole article and all of the different factors of the article, if statistics isn't part of what you can critique, there's still a whole bunch more that you can critique.
Thank you, Geralyn. I think that was a good comment in terms of, there's bits and pieces, and kind of our theme today was maybe going slowly and getting components in as we go and learning along as we go. So with that, I think we're going to head out and close out our webinar. I want to thank everyone again for their time. Thank you all for joining us, and I hope you have a great rest of the week. Thank you.